a dog is shocky or dehydrated, then you may press that down and it may turn white and just stay white, turn white or turn back to pink very slowly. So you can just practice doing that to see what's normal for your dog. And then you'll be able to, if you have to call the vet, go, I think my dog is in shock because it's taking so long for this to come back. Normal heart rate in dogs varies a lot, 60 to 150 beats per minute. I would count your dog's heart rate at rest because that's going to give you the best what is normal for your dog. And I will say that your very athletic dogs may have heart rates that are 50. I see a lot of agility dogs and fly ball dogs in my practice. And some of those dogs, it's like you go to listen to their heart and it's like bump, bump, bump. And if you didn't know that that was a very athletic dog, you would say that heart rate is way too slow. But that's normal for a very athletic dog. So just see what's normal for your guy so you can tell if it's normal or not. Respirations, 30 to 80 per minute. Counting respirations is really hard. And at the office, we just sort of go within normal limits or the dog is panting. See what's normal for your dog. At rest is the one we're usually counting. Now, if they're out exercising, doing something really exciting, it's going to be a lot faster. But if your dog's respiratory rate is much higher than normal at rest, then you may have a problem. To check for hydration, you pull the skin up right over their shoulders, and it should snap back down just like your skin snaps down when you let it go. If you pull it up and it goes, meow, then the dog is getting dehydrated. Now, one thing about that is that older dogs sometimes lose some of the elasticity in their skin. So going down slower may be normal for them. So again, see what's normal for your dog so you can see if it's different. You can also check their gums if you think they're getting dehydrated. One of the first signs of dehydration is the gums will be tacky or sticky. If they're to the point where they're so dehydrated, their eyes are looking sunken, then you have real problems. And I don't think I added it on here, but normal temperature for dogs is 101.5 to 102.5. Excited dogs will a lot of times be 103.5. That's okay. We'll talk more about heat stroke here in a minute, but you got to kind of know what's normal before you know what's abnormal.
Libbye, a question. Yes. How do you take a dog's pulse?
The easiest place is usually on the big femoral artery that's right on the inside of their thigh. And you can feel they're kind of in the middle of their thigh, and you can feel especially on turf-sized dogs, you can feel the big vessel there, and then you just count it. You can count the heart rate if you can feel the heart. Also, we count them with a stethoscope, of course. But if it's easier just to put your hand on the dog's heart and count, you can count it that way too.
and respiration, how would you count respiration?
You just watch them breathe in and out.
Okay.
And count one every time they breathe in and out. Which is why I say it's hard to do, because a lot of times they're wiggling around or panting or, whatever they're doing at the moment. Okay, so one of the things that you may experience, especially if you're out hiking or out and about, are allergic reactions. And this is a great picture of a friend's puppy that she sent me one night and said, I think we have a bee sting problem. If you can see the swollen eyes and the pinkness around the eyes and the little fat pudgy nose, which is just starting. And this one, you can kind of see the hives bumping up and the pinkness around the eyes. I have a little pointer. Oh, can y'all see that if I point with it? Oh, yes. Excellent. Okay, so you can see the redness around the eyes and the bumps. So he's having a really good reaction. I think he had eaten a bee, was that one. That's the most common thing we see are insect stings. We see some vaccination reactions. Usually the vaccination reactions are a little bit 30 minutes to several hours after the vaccine. And some dogs will have such a reaction that they come in looking like a Shar-Pei with their head all swollen. If the animal's going to have a really dangerous reaction, that's usually within 20 minutes of either the bee sting or the vaccination. So although all the swelling and stuff looks bad, these are generally not dangerous. It's the ones that get stung and go down really quickly, or they get a vaccine and they collapse on the table. Those are the really dangerous ones. So most of the time what you'll see is just this hives. Some dogs will have vomiting diarrhea along with this. But this is the most common form. It's rare to see a true anaphylactic reaction where they collapse and go into shock. So you'll see the hives and swollen face and rash. Sometimes they'll have hives all over them. So what are you going to do if you're out and about or you're home and not close to the vet's office? You can give Benadryl. The dose for Benadryl is 1 milligram per pound. So for a turf-sized dog, usually Benadryl, the generic Benadryl capsules are 25 milligrams. So usually 2 of those. Even if you feel like it's progressing to the point you're going to have to take them to the vet, go ahead and give them the Benadryl. A lot of them will be better if it's very far to the clinic. They'll be looking better already by the time they get in. But you're not going to hurt anything with Benadryl. So go ahead and give it. We may have to give, if they're really having a big reaction, we may have to give steroids by injection. But the Benadryl is not going to hurt anything. Go ahead and give it. Oh, there we go, 25 milligram caps. Okay, when is a allergic reaction an emergency? If there's wheezing, panting, anxious, difficulty breathing. And it's always better to err on the side of caution with these things. You may get to the vet and they can go, this is fine, you've given the Benadryl, we're good. But it's particularly a problem if they start to have trouble breathing. That's those dangerous reactions. Okay, any questions about that? Am I talking too fast in my southern drawl?
No, you're fine.
Okay. Sometimes I'm hard to understand. Okay, so, oh my goodness, we've had an accident and now we have bleeding. What are we going to do? All right, minor bleeding should stop pretty much on its own in 6 or 7 minutes. I mean, it may look like carnage, but it should stop on its own and it'll clot and stop on its own unless the dog has some kind of, you know, von Willebrand's or something where they don't clot. You know, toenails that are broken, that kind of stuff, pulled off dew claws. It looks, like I said, or if they bite their tongue, that kind of bleeding looks like a tremendous amount of blood because they smear it everywhere. Nosebleeds always look like they're bleeding to death. But those things should stop pretty quickly. Even though it seems like a really long time, it looks like a lot of blood, those are generally not dangerous. Whoops, went the wrong way. Okay, major bleeding, arterial bleeding will be spurting and pumping, and it won't stop on its own. So for those, you just apply pressure, just like you would on a person, apply pressure and call the vet, get the dog in. Sometimes we have to put them under anesthesia and tie something off. It's pretty rare, but it does happen. For nosebleeds can be really hard to get stopped just because they keep snorting. They'll finally get a clot and then they and sneeze and it bleeds again. So for those, you can put an ice pack on their nose. And sometimes we do have to get those in. I have occasionally had dogs we had to put under anesthesia to get them to quit snorting long enough for the blood to clot. Okay, broken toenails, always a problem. Yanked out dew claws. They kind of, honestly, they look worse than they are. Dogs don't bleed to death from broken toenails. It just seems like it. You can use a styptic pencil like men use when they're shaving. Those are easy to keep in your first aid kit. But if you don't have that, anything granular like flour, or you can take bar soap and just stick the nail down in the bar soap, and those will usually get them to quit. So yes, it looks terrible, but it will stop eventually. Even if you don't do anything, it'll stop eventually.
Question about the major bleeding.
Yes.
Apply the pressure and you call the vet. Now, how do you transport the dog to the vet while still applying pressure? What should you do? It's
probably some places you can't really get to. You just got to have somebody come with you and hold it. If it's down on a leg or something, you can do it with vet wrap. If you've got vet wrap in your first aid kit, you may just have to kind of do the best you can if you're by yourself. But pressure is the thing that's going to help you there.
Okay.
Not always easy to do.
And then on the broken nails, Bruce has a question.
Oh, are you muted? I think you're muted. There we go.
Yeah, well, my question was actually slightly different. It was about ripped pads.
We're going to talk about that. We have a whole slide of it. We have a whole slide about that.
Okay, good.
Coming up. Okay, anything else?
That's what happens with our dogs quite a bit.
Yes, that's why it has a whole slide. Okay. GI upsets. Always a fun problem on the road because dogs eat things. Okay, vomiting and diarrhea. Everyone's worst nightmare is that vomiting noise in a hotel room or the diarrhea noise in a hotel room. So when you get home from the dog show, if the dog's been having an upset stomach while you're there, isolate if it may be infectious. It's probably better just to go ahead and isolate them if you think they may have picked up something at the show than to find out when you have 5 dogs vomiting that yes, it was indeed infectious. This is the thing that I have a really hard time getting people to do. If the dog is vomiting and having diarrhea, take the food and water away from it for 24 hours. It's not going to get dehydrated in 24 hours unless it's just absolutely a faucet of vomiting and diarrhea. And if it's having vomiting and diarrhea that bad, it needs to be in the clinic on IV fluids. But people want to, it's like, Fluffy vomited and now she won't eat. Good. Fluffy is smart. Let her not eat. Because what happens is the dog vomits and then people are like, oh, she won't eat. And then you tempt them with something else, which they then eat because it was just irresistible. And then they throw up some more. Or people worry about them getting dehydrated. And so they give them broth or something to drink. Or the dog itself will go and drink a lot of water when they're nauseated, and then they throw up. And then they drink some more, and then they throw up again. You have to get them off of oral food and water while their stomach settles down. Like I said, the dogs often have the best idea, which is to not eat if we don't try to tempt them into it. You can use Pepto in dogs, not in cats, for those of you who have cats, because it does have some aspirin in it. I wouldn't give a lot of doses of it, but I'm pretty sure in your notes, the doses for all these things are in the notes. Pepcid works really well, Tagamet, those kinds of things for vomiting and diarrhea. Oh, the note on Pepto, if you give Pepto, it makes the stool look really black, so don't freak out when you see it. Because people will think that it's blood. It's not. It's the bismuth in there. It makes it look black. Okay. Once you get everything quieted down, and you haven't any vomiting for 12 to 24 hours, depending. Our dogs are big enough they can go 24 hours. Sometimes on the little itty bitty, Yorkie, tiny kind of guys that will get hypoglycemic, we'll start them back a little sooner. Then you can start them back on a bland diet. And bland diet is, like rice and boiled egg or rice and boiled chicken. There are canned bland diets, EN or ID. But what you want to do is, don't just give them a beefsteak because you felt sorry that they were throwing up. That'll start the whole thing back over again. The GI tract needs to rest. It'll rejuvenate itself pretty quickly. When is vomiting and diarrhea an emergency? If it lasts more than 24 hours, or if it's bloody. Now, that said, sometimes dogs will vomit blood if they're really retching hard, and they'll pop a blood vessel in their esophagus, and you'll get some blood in there, which is really kind of okay, but they need to be seen. If you're seeing blood, they need to be seen. They also need to be seen if this vomiting and diarrhea is accompanied by a fever, if they're acting like their belly hurts, If you press on their belly and they go, that sometimes can be a foreign body or something really bad going on there. If they're very depressed, you've got vomiting. If the dog is vomiting and diarrhea and bouncing around the house like normal, we don't worry so much. If it's vomiting and diarrhea and it hasn't moved in 12 hours, then we're worried. Or if you start to see the signs of dehydration that we were talking about before, the tacky gums, the tinting skin, then they need to be seen.
Let me jump in for just a moment here. I'm getting a couple of questions about dosage. Libbye has prepared a document which is available for downloading, and I'll give you the information how to download it at the end of the presentation. But it has all of the dosing for Pepto, Pepsid, Tagamet, and a whole bunch of other types of preparations and drugs. Did you want to add anything to that, Libbye?
No, I thought it was a lot easier just to give you a list, because that way you don't have to try to write stuff down. Oh, look, we have a special guest. So it's all there in the list.
Okay.
Most of those are by weight, and so that will give you something to hang on to.
Another question: what would you say is what is a bland diet?
A bland diet is something that's easy to digest. So if it's going to have protein, it's something really easy to digest, like egg or boiled chicken. You can do boiled hamburger, but it tends to be greasier, and you don't want anything greasy. So that would be good. You can use cream of wheat if anybody, is that a California thing? I don't know if y'all have that. But so pasta, that kind of stuff that goes down really easy and doesn't leave a lot of debris in the GI tract.
Would a boiled chicken and rice be considered a bland diet?
Yes.
Okay.
That's usually the easiest one and the one we most often recommend. Either that or rice and boiled egg.
Thank you.
Okay. Onward. Okay, toxins. So what do you do if you think your dog may have gotten into a toxin? There's a whole big longer section in the big first aid from A to Z long presentation. But we're just going to talk sort of more generally now about what to do if you think your dog has gotten into a toxin. One of the main things is if you think they've gotten into something toxic is get the container and take it with you to the vet. That helps us tremendously in figuring out if something's really going to be a problem or not. Okay, so when would you induce vomiting if you think that they've gotten into something? Or if you think they've eaten, part of a toy or, some mulch or rocks or, whatever. You have to induce vomiting within 30 to 90 minutes because dogs' stomachs empty really quickly. So we try to get them within 30 minutes. You probably get about 60% of it at 90 minutes, but it's still worth trying at 90 minutes. And the easiest way to induce vomiting at home is with hydrogen peroxide. It's H2O2. And it's 1 ml per pound up to 50 mLs. So I did the math for you because I'm a nice person. So a 50-pound dog, that's about 3 tablespoons or a bit less than 1/4 of a cup. It's, you're not trying for an exact dose here. You're just kind of going for, close enough. The times you do not want to induce vomiting, caustic toxins like detergent or house cleaning stuff, Rocal, don't induce vomiting with Rocal. I say that because I had a dog once drink an entire container of Rocal when the kennel cleaning system malfunctioned at the clinic where I worked over Christmas. The dog ended up with a tracheostomy. It was not good. He did live though. Fabric softeners, acids, corrosives. You also don't want to induce vomiting if you think the dog's eaten something sharp. So if you think the dog ate a sewing needle, don't induce vomiting. In that case, in cases of things that are caustic, that might be caustic coming back up, you can give them milk or yogurt at basically the same dose as you give peroxide. So 3 tablespoons, a bit less than 1/4 of a cup, because you just want, in that case, you just want to soothe. And I'll tell you a trick I learned from a surgeon when I had a Labrador surprise puppy who ate a sewing needle that I was sending down there. But the people weren't going to be able to get there for a while. They said, have them feed him some spinach, frozen spinach, because the spinach is slimy and it wraps around the needles and it will often cushion the GI tract. Sometimes they'll even pass them. But that's kind of a, if you're stuck in the middle of nowhere and you need something to do so you can get into the vet, you can try the spinach trick. I'll often give my dogs, because turf puppies, you know how they are, Metamucil, a couple tablespoons of Metamucil and some canned food, like once a week, just to carry through whatever they've eaten that I don't know about. So the rocks, the horse hooves, the sticks, that kind of stuff. But that's kind of the overview of what to do with toxins. Like I said, the main thing is if you think you've gotten into a toxin, is get the container if it's some kind of chemical thing and take it with you to the vet. Oh, what are we throwing? That was exciting.
Libbye,
yes.
On the hydrogen peroxide.
Yes.
Can you overdose on that?
Theoretically, they say you can. If you gave them enough, you could rupture their stomach or something. I don't know. We often at the office, well, we have apomorphine, which is the drug that induces vomiting. But sometimes even that doesn't work. And I've probably given dogs a lot more hydrogen peroxide than what it says here without a problem. So I would, kind of stick to those doses. You'd have to give them a lot to really overdose them because it's just going to turn into water and oxygen. The one thing I will say about the hydrogen peroxide is it has to be fairly fresh to work because it really loses its zing when it sits around on the shelf for 10 years. So you might keep some periodically refresh your supply.
Libbye, what about charcoal?
I'm sorry?
What about using canned pumpkin and veggie oil to help a dog pass something? Not quite vomiting, but more like if they're
passing a foreign body. Yeah, all those things, fibrous things. We used to give them, back in the day, we used to give them bread, just white bread, because it makes a nice ball around stuff and carries the Christmas ornament through or whatever they ate. So what did you ask me about down there?
Libbye, what about charcoal?
What about what?
Charcoal.
Charcoal. Oh, we use activated charcoal with toxins at the office. I wouldn't give them just plain charcoal briquettes because, they may have fire starting chemicals in them. But if you keep activated charcoal, then yes, you can give it. Now you have to be careful not to have them get choked on it if they're symptomatic. We sometimes, if the dog is, getting symptomatic from whatever the toxin is, we'll give it to them with a stomach tube. It's also messy as all get out. Stuff is terrible. They do have some now that comes in a like a syringe that's in a measured dose in a syringe, and that might be doable if you keep it on hand for the situation you guys are in where you've got lots of dogs. It certainly wouldn't hurt to have some. Again, that's one of those things, you're not going to hurt anything with it. So I think that would be fine. And it's a lot less messy when it's already mixed. We used to get it in big jars, dry, and then you had to mix it with water. It gets everywhere. The worst. Okay, any more questions on that? Okay. Heat strokes. This is a problem that we all have. You guys have it out there, although you probably don't deal with the humidity that we do. But I know it gets really hot. So these little puppies they're staying cool in the heat. Okay. When I tell people, and like I said, y'all don't deal with the humidity as much as we do, but if the air temperature plus the humidity is 150 or greater, then you got to be really careful. And here we get problems where it's 80 degrees, but it's 60% humidity. And dogs will have heat strokes when people aren't expecting them to. Or it'll be 70 degrees and 100% humidity. I've seen dogs have heat strokes in some what you would think were odd conditions, but it's the humidity that causing the problem here. Like I said, y'all are probably lucky out there. You don't have to deal with that so much. And this slide is to remind me that even dogs that are doing water sports and in the water can still have heat strokes. Okay, what are the dogs you have to be really careful with when it's hot? Obesity is a big one. If the dog has laryngeal paralysis, and we do see a good bit of that in Belgians, if they make that roaring noise when they breathe, those dogs may have laryngeal paralysis and they have trouble exchanging heat. The older they are, the more they tend to have heat strokes. Really young puppies don't dissipate heat super well either, so you have to be careful with little puppies. And dogs that have had heat strokes prior are much more susceptible to them later. So if you have a dog that's had a heat stroke, you want to be extra careful with them. Okay, so what are the signs of heat stroke? Their ears get really red inside, and you get the dark red spoon-shaped tongue. When the dogs, they're trying to dissipate their heat, and what they do is they make their tongue wider and wider for more surface area. And when it gets to that part where it's shaped like a spoon on the bottom, they're getting way too hot. They are really having trouble dissipating their heat. Oops. And dogs that are having trouble will breathe with their mouth way open, and you'll get the rapid or roaring breathing. At that point, it's not laryngeal paralysis, they're just having a heat stroke. So they'll do that thing. I tried to find a picture of one doing that and I couldn't come up with one. Because I'm not usually taking pictures when dogs are having heat strokes. And a lot of times they'll get thick, ropey saliva. And another thing on our dogs, because they tend to want to work even if they're getting way too hot, so we have to kind of protect them from themselves. And what you'll see a lot of times if they're getting too hot is they don't resist when you push them down or sideways. Instead of, you push on the dog and it kind of, continues to stand, you push them and they'll stumble sideways, or you push them down and they just sort of fall down. Those guys are really losing it. And they're getting way too hot. If a Belgian quits working, a lot of times it's because they're too hot. And some of them, but don't depend on that, because like we were just talking about, Belgians won't quit. A lot of them will just keep on working until they have a heat stroke. So if you've got a dog with that kind of temperament, then it's kind of up to you. It's your place to go, you're getting too hot. I'm not going to do this run. It's too hot out here. This agility equipment is 1,000,000 degrees and you're getting too hot. We're going to call it. If they really, really get too hot, then you may get vomiting and diarrhea. A lot of them will have really watery, awful diarrhea. And then they collapse. And then you're really in trouble. Heat stroke is considered to be a temperature of over 106. Now, here's the asterisk there. Dogs that are dogs that are very excited, often like if they're getting ready to run agility and they're just so excited, or they're gonna do whatever they do and they're just beside themselves with dog excitement. Those dogs can have temperatures of like 107 sometimes. What you'll find is that their temperature will actually even go down when they're on course, once they get the anticipation stage over with. And then when they come off course, they should cool down really quickly. So you can't, walk your dog up to the agility line, have it being a quivering, hysterical mess, and then take its temperature and go, oh, you're having a heat stroke, it's 106. Because that may not be the case, but they should cool down pretty quickly. Because it's medicine and nothing's ever always. Ooh. Okay, once the temperature gets above 109 degrees, then major organ damage occurs. That's when they sort of start cooking their own organs. This is very bad. So what are you going to do if you think the dog's having a heat stroke? So you want to get them in cool, not icy water, and the big places to cool are inside the thighs. Where we were talking about taking the pulse earlier, where the big femoral artery is, on those inside of those thighs, that's the artery that's closest to the skin surface where you can actually cool it. So some people say tepid water, cool water. You just don't want to plunge them in a bag of ice because that constricts the vessels and doesn't help with your heat exchange. What we do in the office a lot of times is we'll give them an enema with cool water so we can really get the core temperature down, and we'll put them on IV fluids that are cool. But for your purposes, you're going to have to go to the vet. We probably talk about this in a minute. You're going to have to go to the vet with a dog having a heat stroke, but cool them off first, or at least get it started. Get them out of the sun. Get them in a cool place. Use a fan if you have it. Oh, here we go. Cooling the dogs before transport lowers mortality from 61% to 38% in a study that was done. So it's really important. Don't completely freak out and throw the dog in your car and head to the vet. Wet it first, underneath, on the arteries, then put it in the car and take it to the vet. Now, here's a really important thing. If you're cooling a dog, you only want to cool them down to 103 degrees. You'd think you'd want to cool them down to their normal body temperature, but what happens is when their internal thermostat's been all whacked out by being so high, if you cool them past 103 and get down to that point, then it'll plummet and the temperature will go down too low. So when we're cooling dogs in the office, we cool them down to 103 and then we remove the coolant stuff. We take them out of the water or whatever we're doing with them. So don't get too crazy on that. You just want to cool them down. And then they need to go to the vet. Dogs that die of heat stroke will often die 2 days later, a week later, because what kills them is the organ damage that was done while they were overheated. And they'll throw blood clots and have kidney failure and all these problems that show up later. So even though you may have gotten the dog all nice and cooled down to 103, they still need to see your vet and be really closely monitored. Sometimes we put them on aspirin to try to prevent clots. Your vet will do whatever needs to be done. But it's really important that heat stroke dogs be seen. Sometimes we don't need to do anything. They're doing fine and they can just go home and then be careful about having another heat stroke. But they do need to be seen. Okay. Any questions about heat strokes? John's reading. Okay.
Oh, one question.
Yes.
Yes. What about using alcohol, like on their pads? Does that help? You
can do that. The water is better, but if you've got alcohol, that's fine. We do that sometimes in the office. You know, anything to increase heat exchange is fine. We used to like throw them in a tub full of ice packs, but that's not the best idea. So, okay. Oh no, we've had a dog fight. Of course, the Belgian people know these dogs are playing, but when I show this slide at like all breed things, the people freak out. Oh my God, they're killing each other. Nah, they're just playing. Okay, let's talk about some quickie bandages if you need to bandage something up right while you're not handy. So you've got a wound of whatever thing has befallen your poor dog. So you want a clean wound with betadine scrub is great, or even just antibacterial soap. Antibacterial soaps are so prevalent these days, it's easy to find one now. It used to be more of a problem, but the pump dial antibacterial soap, fine. Oops. Apply ointment if needed. A lot of times all you really need is to clean it up and put a clean bandage on it. If it makes you feel better, you can put some Neosporin on it. But here's the Neosporin trick. You don't want to use it more than 3 days in a row because a lot of dogs will sensitize to it and then your wound won't heal. And if it's a puncture wound, like from a bite wound, those guys probably need to be antibiotics because the bacteria gets shoved down in this tiny little hole and then it closes over, the top closes over, so there's not much to see. So you clean it all up and you put your Neosporin on it. And meanwhile, down in the hole where there's no air, the nasty bacteria love to grow, and that's all happening underneath the surface. So dog bites probably need antibiotics in a lot of cases. If it's just a scratch or it's really shallow, then you'll be okay like this. But you can use, if you need a bandage, TELF is great because it doesn't stick. A gauze pad. If you're out in the middle of nowhere, baby diapers make great bandages. Sanitary napkins are great. Those things are all clean and really absorbent and easy to get. Mini pads work great for little dogs. Oops. So if you're having to cover up something big, you can wrap the diaper around it, cut it to the appropriate width around the limb, and then you can use the diaper tabs to hold it in place if you're trying to bandage a leg. And then you can wrap with roll gauze or a vet wrap. Now, here's the vet wrap thing. If you're not used to using vet wrap, when you put it on, if you stretch it, after you get the bandage on, it unstretches itself and it gets tighter and tighter and tighter. So you have to be really careful with it. So I usually pull it off the roll a little bit, wrap it, pull some more off the roll. So I'm not pulling on the roll because it becomes a tourniquet if you pull on it when you put it on there. And remember, don't put it on there too tight. You can put the bandage back on if it falls off, that's fine. But if you rot their foot off or their tail off, then we can't put that back on. If you cut the circulation off, and if you see swelling starting in the paw or whatever's below the bandage, take it off, do it again. If you need tape, you can use adhesive tape. The human adhesive paper tape doesn't work worth a darn on animals. That stuff doesn't stick to anything. You can use duct tape or electrical tape in a pinch. Be careful with those for anything. Don't leave them on there for a long time because they don't breathe and stuff will get really sweaty underneath the bandage. But it's fine for just the quickie bandage to get where you're going to get something properly bandaged. Those are fine. Duct tape fixes everything. I live on a farm. That and hay string. See, we have a whole section on pads.
Libbye, question
Yes.
about the bandaging.
Yes.
How do you keep the dog from unwrapping the bandage?
Well, you put an e-collar on it, or you use some chew guard. Well, there are a lot of sprays that are made to try to keep them from chewing on that stuff. It works on some dogs and not on others. Some dogs will leave it alone if you just slip a sock over it, if it's a foot thing. It just kind of depends on the individual dog. And some dogs, I don't care what you do, they will not leave a bandage on. And on those, we just have learned to admit defeat and go some other route. Okay, anything else on bandages? All right, pads. Let's talk about pads because they always get torn up. Blistered pads. I see this is probably the emergency that we see the most when they're out working dogs. Herding dogs get that a lot of times because they're working on rough surfaces. The agility dogs get them sometimes because they hit a A-frame wrong or, you know, they're gritty surfaces. But this is what they look like. Neosporin, so here's some things to do for blistered pads. Neosporin actually makes a pain formula that has some numbing agent in it. There's some stuff you can get called EMT gel that's really good for these. If you're in a pinch and all you can do is the local convenient mart or 7-Eleven, if you can find the Ambisol stuff that they use on babies for teething, it's pretty good numbing. If you need the dog to be sound for just a little bit to finish up bringing the sheep in or something, Ambisol works and it's fine. Preparation H is actually really good for wounds like this. It tends to really help with the irritation and takes a lot of the burny sting out. You can try to glue these things back with new skin, but this outer layer of the pad here is just dead tissue. So trying to glue it back on generally just is more painful. That new skin stuff burns like fire. Dogs will absolutely lose their minds if you put that on there. So you can try it, but you're almost better with it flapped up like that, just to take little scissors and trim the edge so it's not catching on everything. You can do Epsom salt soaks, kind of soften that up and let it heal. If you've got a dog that's having to work, you can put a light wrap on it. Booties seem to almost make them worse because the booty is sliding and it's just tearing it up worse. And these will heal in 2 to 7 days. So you can do a lot of stuff to them and they'll heal in 7 days, or you can do nothing to them and they'll heal in a week. It's kind of the way they go. You just have to wait for them to heal. Okay, any questions on pads? Like I said, I used to, back in the day when my herding dogs were obnoxious and used to run their pads off, I used to put medicine on them and wrap them up and do all that stuff until I realized that it doesn't make any difference. They heal. Now the dogs don't do that, and now I just, it'll heal. Okay, let's talk about seizures for a minute, because that's probably the scariest thing to have to watch if your dog's having seizures. It freaks us out even at the office when I've got an IV in and anti-seizure medicine. It's just unpleasant to watch an animal have a seizure. It probably bothers us way more than them, but it's still very scary. So what do you do if your dog is having a seizure? So don't try to move the dog unless they're about to fall down the stairs or seizure into a plate glass window or something. Because when they're having a seizure, if they're having a full-blown seizure, they don't know it's you. And if they bite you in the middle of a seizure, they do not let go and they don't have any bite inhibition. Keep your hands away from their mouth. They're not going to choke to death on their tongue or anything weird like that. The most important thing you can do for your vet is, and I know it's hard because all this is going on and it's freaking everybody out, is note how long the seizure lasts. Most of them are very short. People will come in and say the dog's been seizuring for 10 minutes, and I'm like, probably not. Note whether the dog is like down flat paddling, losing bladder or bowel control. Those are grand mal seizures. A lot of the seizures that we see are just focal seizures where the dog bobs its head or chomps its teeth or twitches one leg. Or in some dogs, in fact, our old Sheltie used to have almost absent seizures where he just looked like he was about to have a seizure and he never did. It was strange, but he never progressed from that. Keep a seizure diary because we need to know how often it's happening. If you think it's from a toxin, that's a whole different story than if we think it's a dog with epilepsy. Video is super, super helpful because I've had dogs that the owner said were having seizures that when I could see the video were not seizures. We had a dog that had, bulldogs have this weird head bobbing thing that's just a benign spasm thing. That's not a seizure. So that dog was like, he does that, but it won't hurt anything. I've seen dogs that were actually having fainting spells from a heart problem that the owner was perceiving as seizures. I also had one dog that when they brought the video, it was, well, that looks like a seizure and that looks like the dog is passing out. That dog ended up with a pacemaker and brain surgery for its brain tumor. Very unusual, but because we had the video, we could see that it truly did have two different problems. So video is super helpful. Okay, when are seizures an emergency? If they last more than 5 minutes, or they're having multiple seizures, where they're having a seizure and then they're out of it for a minute and they're having another seizure, those kind of continuous seizures like that can be a problem. Dogs don't generally die during seizures, but I can't say it never happens, but almost never, unless they get into cluster seizures, where they're just having one after the other after the other.
What does a seizure look and sound like?
It varies a great deal. Like I said, some dogs will have very minor focal seizures where they'll just sit and drool, or they'll chomp their teeth together. They're called chewing gum seizures, or they'll have one leg that twitches. A grand mal seizure the dog is obviously unconscious. They go down on their side, they paddle, they lose bladder and bowel control, they get stiff and that's a full-blown seizure. But it can vary tremendously, and that's why having video, if it's a grand mal seizure, you're going to know that. But on some of these odd seizures, the little focal seizures, the video is tremendously helpful. So we can see if what we're seeing is actually seizure or something else.
That's a good question, Libbye. I had a friend whose dog would twitch periodically,
Mm-hmm.
and it went on for a long time before it happened at the vet's office,
Mm-hmm.
and the vet said the dog is having a seizure.
Yes.
It's not always. How do you? I guess to follow up on Alan's question, how can you tell that something is a seizure versus, sometimes the dog is sleeping and you can tell, boy, they're having a dream about running.
Right. With seizures, they're usually not, they're conscious. Sometimes they're not really conscious, but usually it's hard to interrupt a seizure. Like if the dog is dreaming and twitching and running, but you wake him up, it stops. But seizures are more uncontrollable. The dog's having his little moment. And even if you say, Fluffy, Fluffy, what's wrong? The dog is not able to stop that consciously.
Okay.
And sometimes we just have to look, and sometimes we have to send the video to the neurologist because we can't tell either.
What kind of seizures do you find most common in Belgians?
It used to be grand mal seizures, but I think we're seeing a lot more focal seizures now. And I don't know if they just weren't recognized previously and we're better at figuring out what's going on now, or if we've really switched over to more focal seizures. I know in Europe, they have tremendously focal seizures than they do actual full-blown seizures. And that's one of the things that makes it so hard to look for seizure genetics, because they may not be the same genes involved in the different kinds of seizures. And it's really difficult to classify all that stuff.
Thank you.
Because it all gets lumped in under seizure, but they may be very different. Okay?
Thank you.
Uh-huh. Oh, see your vet, yes. Okay. When does your hair catch on fire and you have to call the vet immediately and get them in there? Anytime you see, if you think there's abdominal distension, that needs to be looked at. Could be bloat, could be fluid from a heart problem, could be a tumor, but abdominal distension, rarely a good thing. And that needs to be looked at. Non-productive retching, that's another one of the bloat symptoms. And we didn't really talk about bloat here, that's in another part of this deal, but the dog that's just walking around like it wants to vomit, but it can't. And they retch and nothing comes up and they're restless and anxious. Those kind of things, especially if you see abdominal distension, make us really worry about bloat. And that is a true emergency. Anytime you get difficulty breathing or blue-gray gums, if you want to get into your vet clinic when they're full, tell them your dog's having trouble breathing, because we always get those dogs in. They rarely have trouble breathing when they get there, but difficulty breathing is one of the things that can really be an emergency. And kind of like we were talking about under the vomiting and diarrhea, reluctance to move, extreme depression. This is not normal for this dog. Why is he still laying where he was when I went to work? That's an emergency. And the arterial kind of bleeding, the major bleeding that's not controlled in 6 or 7 minutes, that of course is an emergency. Squinty, teary eyes, that's an emergency that needs to be seen quickly. Don't fool around with eye things. That's another thing that gets you in your vet clinic. Tell them you think your dog has a corneal ulcer, because dogs that are with squinting, teary eyes often have scratches or ulcers on the cornea, and those can go bad really, really quickly to the point the dog's eye ruptures. So eye emergencies we tend to see really quickly, as quick as we can. And don't put the old ointment that you have laying around from some previous problem in the eye, because for one thing, it's probably full of bacteria. And the other thing that happens, and this happened recently, is Fluffy has the squinty, teary eye, but Buster had that last year in the summer when he had allergies, but I used his ointment. Well, Buster's ointment had a steroid in it, and if you put a steroid in a corneal ulcer, the cornea just kind of melts, and then the eye can rupture. I had a ruptured eye not too long ago from somebody that did that, because they were, they thought they were going to fix it, but they had the wrong ointment. Don't mess with eyes. Vomiting for more than 24 hours, bloody diarrhea, or vomiting. Remember, vomiting if the dog has a fever or just is super depressed. Excessive thirst and lethargy in a female recently in season, that's an emergency, because that may be a pyometra, and those can go south really quick. So pay extra attention to your intact girls for about the month or so after they're in heat. That's when we see pyo a lot of times. They can be hard to diagnose, so you need to get those in. Exposure to a toxin, of course, you're going to take those guys in. Oh, heat stroke that we talked about. Most of these things that we talked about under heat stroke, those have to be seen also. Okay. So now I used to recommend a really good book on first aid, but now we have the Pet First Aid app from Red Cross. That's really nice. It's very much like what we talked about here tonight, but it's all right there in your phone for you. It's free. You can download it. I think it's just really good for everybody to have on their phone. And I believe you can just load the number of vets, or if you know you're going to be someplace and you got the emergency clinic number, you can just load that in there so you don't have to think about it when you're in the midst of an emergency. So the major thing with the first aid stuff is be prepared, and not even so much in the stuff you have around, but kind of in your mind, so you kind of know what might be an emergency and what might not. And always keep in mind that you know your dog, and if you think it's an emergency, because you people are good dog people, if you think it's an emergency, it's an emergency. If one of you guys calls me and says, I have an emergency, I'm going to see it. Because y'all are savvy dog people and you know what you're doing. If you think it's an emergency, don't be dissuaded from getting the dog in if you really feel like it's having an emergency. Okay, I think that's it. It is it. All right, questions?
So if we wanted to create a first aid kit, what would be the essential things? Or is there a first aid kit that you could recommend that we purchase? Or
I believe that John has the first aid kit with the drug doses on the handout that you guys can download. That's got all the first aid kit stuff in there, because I figured that was easier than than reading the what was in the first aid kit. Yes.
Yeah. Thank you.
Sure.
Somebody just posted a note saying, what are the signs of pyometra?
They can be really nebulous, and in the bigger presentation I have a whole slide about that. It can be just not eating, depression. You can see vaginal discharge, but you may not if the cervix is closed, so don't aim it on that. Some dogs, a lot of bitches will drink tons and tons of water with a pyo. I've had them present as back pain. They can be really hard to determine for sure. So any bitch that seems at least bit off, especially that month after they're in season, I'm always kind of pyo till proven otherwise. Just because we don't see very many intact bitches, but all my friends have them. and they all call me. So that's kind of what I tell them.
Thanks, Libbye. This was great. Also good seeing you.
Oh, good to see you too. It's so fun to see everybody.
Yeah.